HIV and AIDS? Yes or no or yes? AIDS is a virus that causes HIV. Answer is HIV is a virus that causes for the AIDS. AIDS is acquired immunodeficiency syndrome. It's a kind of a symptom. When you get infected with HIV, we show something like that, the immunodeficiency syndrome. Next slide. Okay, what's the percentage of the these infected with the HIV? Women. 25 or 50 or 75? 75? 25. Another?
50%.
50%. What about any person 75? Oh, hey. Okay. Next slide, please. Yeah, nearly 50%. But depends on the country, of course. But the many of the people are infected in women, about the 50%. In this country, maybe the female, the woman is much higher because of some system for religions. And so, next slide, please. Yeah, I saw it the other day on the slide. Women represent almost half, 49% of the whole adults living with HIV worldwide. And also the deaths, leading deaths of the reproductive age, about 20 to 30, 40. It is very high. Next slide, please. Okay, is it possible to lower the risk of the HIV positive woman infected to have baby? Yes? No? Only very slight. Answer is? Yes, the risk can be made much lower. Not just lower, they have to take a medicine. And the viral load should be decreased. The infections occur at the birth canal or breast. If the mother takes ARV properly, viral load is undetectable. Undetectable is non-transmittable. Next slide. Yeah, and here undetectable is untransmittable. Even back through the breast milk, but patient has to take medicine. All right, properly. Just to take a medicine is not enough. Next slide. This will be the first one. Okay. How many sides of the condom?
One size fits all.
Big one, small one, or regular size? Or any of the big or small? Universal? Answer is many different sizes. Okay. If I go back to US next month or next month, I can bring it.
I know.
Right? Many different sizes. Next slide, please. Oh, this is the last one. I will show you that the other one is also related to that question of the condom. This answer must be 80% or above. Alright, about 3-4 missing. Next one, please. So just put the correct number. The answer was correct. Put the number. We did the 17. Let's say you have a 14. Write the 14 and circle. So we can check it. Alright, we will finish for the first one and next one. So you can put the data in here. Return for oral. You put the number. So return and I will go to the next. Okay, this is the second one. I'm sorry about the delay, but this is the second question or quiz. Right? Next slide, please. Next slide, please. Next slide, please. Okay, the second sheet, right? As Dr. Ramadhan said, just put your number and also the subject. All right, number one. HIV is believed to have evolved from the similar animals. Which one? Baboon, chimpanzee, elephant, cat? Answer is chimpanzee. It is very interesting. There is the monkey HIV or monkey AIDS virus. Monkey HIV, we call, not the monkey HIV, monkey AIDS virus, we call the SIV, Simian immunodeficiency virus. This can be transmitted all the monkeys. However, the chimpanzees or SIV is similar, however, but not homology or amino acid sequence about the 4,000 is similar to HIV, not HIV1. So HIV1 is not the first. Monkey virus is here, become HIV2, and further mutated, become HIV. Something like that possible, but it is entirely different. But it is similar with chimpanzee, not for the baboon. But the human HIV can be transmitted to baboon or transmitted to the chimpanzee, but not small like the monkey. We call the green monkey in the Congo. The HIV, they have a SIV. Green monkey in Congo is having for the SIV monkey virus, but they does not develop AIDS. But take this SIV from the green monkey to another chimpanzee, yes, they develop. So even a human infected with HIV may not develop for the AIDS. Such as the people in the jungle of Africa may be contacted with the town, do the sexual activity to get the money and transmit it for this virus, which does not develop AIDS in these people, but town people. That's a possible, but who knows? Okay, next slide, please. What is the size of the HIV, the particle? Yes? Okay, this is a foot. Shouldn't be, or inch, and this is shouldn't. And centimeter or millimeter. Answer is very tiny. I showed it to you a long time ago. Next slide, please. Yeah, I saw this slide. That virus is around here. It's a nanometer. Okay? Next slide, please. Which is the HIV subtype is most common in Western world? Western world. Not the whole world. A, B, C, D type. The HIV subtype means subtype A, subtype B, subtype C, subtype D, blah, 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 blah. It's not only one. You learn today. HIV is not only one. There is a subtype, very similar. but different type of, and different country. Next slide, please. Answer is D. Subtype D. Huh? I said Western country. Next slide, please. I'll show you why. This is the subtype A, subtype B, subtype C, and others. And others is correct, is also the HIV, but slightly different, but not typical A, B, C. So the Western world is this, the B type. Gay men, or United States, Europe, and Southeast Asia is almost the B. As well as the E type is here, I don't know where it is. However, the C type is more, almost 50% of the world are in the subtype. These are in Africa. Next slide. As I said, subtype A is the Eastern Africa, Kenya, the subtype A and C, sorry. The subtype A is also Kenya, Uganda, Tanzania, blah, 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 and also the Eastern Europe. So most of the Kenyan type of the HIV isolated identified subtype A and C. The subtype B is the common in the American, United States, Central Europe, and United States, or Australia is the subtype B. Most of the gay men, the HIV is subtype B. Next slide, please. The subtype B is also the predominance in these countries are 80%. The global HIV is such as Southern Africa and India. So some of them are identified in Kenya. The HIV strain is subtype is A and C. So which is different type of HIV, different type of the subtype in other countries, not only one. And also, in addition to that, HIV-1 is the first HIV isolated. There is a HIV-2. Right? That's right. Which of these drugs which the community used is on to reduce the mother-to-child transmission? Nevirapine or Inada, there are buildings and aspirin. Answer is this was tested a long time ago when nevirapine was developed and approved. This medicine was used in Uganda. Most of the data for the first 10 medicine are used for the clinical trial in Uganda. So they use for the nevirapine to prevent. But not just the one. Keep taking a nevirapine, then also the baby has to receive the medicine, then we can prevent the transmission. However, problem is, mother has to take a nevirapine for on time until the birth, even taking after the birth because of the virus contained in the breast. That case, if patient or mother make a mistake not to take a medicine, develop for the mutation for resistance, baby cannot use for the nevirapine anymore. So if it's unknown, for example, mother passed away after giving a birth, cannot take care because of the sick, so the kids are transferred to some orphan home and check for what kind of the medicine shall we give it to baby. Check for the mothers. This is very important. Mothers report healthy, maybe not for the baby is infected. But if they find for the baby infected, they have to give a medicine. But depends. If mother is treatment failure nevirapine, cannot give the nevirapine. So quite detail is required. Next slide. This one first. Which famous gay man who died in 1950 movie star. Yes. We can put one more, Inada. Oh, I'm not a layman, so it's good. Okay, answer is this is a first person coming out to the United States. I am HIV infected. I am a layman. Next slide, please. Okay. He was quite young when he died. This is the person for workers. Yeah, he was, yeah. Okay, next slide, please. Alright, so what was the following not to do drug used to treat HIV infection? Protein inhibitor or viral terminator and the nucleoside analog. So answer is there is a two. Oh no, one. This is not anti-ARV. ARV is for the HIV. This is not. So, protein inhibitor is HIV, the nucleotide analog, this is the AGT, 3TC, blah, blah, blah. Okay, next slide, please. What type of the virus is HIV? This is coronavirus. Yeah, yesterday I checked it. Okay, next answer is retrovirus, right? Yeah, we explained to you. We have RNA virus, DNA virus, and RNA virus is a retro, some of it. Okay? Coronavirus is also the RNA virus. Same as the HIV. That's why for the treatment of the coronavirus infected people in Japan and some other countries, they use HIV medicine for coronavirus infected people. Next slide, please. Alright. Which normally there, the cancer, it is rare, but wasn't rare when I was in so, okay. The carcinoma and Kaposi, answer is Kaposi sarcoma. Next slide, please. Kaposi sarcoma is like, I don't know, you've ever seen it before or not. Okay, the Kaposi sarcoma out here. This is Kaposi sarcoma. And this is the beginning. When they get this and this become bigger and united. Alright? This is also the Kaposi sarcoma on the leg. So actually the blood doesn't go through, it's called edema. And the Kaposi sarcoma is not only skin disease but also in the lung. In chest. There is a Kaposi. This is a lung Kaposi sarcoma. And also the rectum, yes. So this rectum over here, I cannot see, but this is kind of the visible symptom of the Kaposi sarcoma. Many of the gay men is infected because of not only HIV, but also about 90% of the people who are infected with cytomegalovirus herpes type 8. That's the cause of the Kaposi sarcoma virus, or the Kaposi sarcoma by the virus. So, in general, the heterosexual people are not infected, not many of them are infected with cytomegalovirus or herpes type 8, number 8. But I saw the one patient, she had a blind. She was able to, but she couldn't see now, and they brought it. It's due to the cytomegalovirus retinitis. No more see anything, and cannot be treated. Okay, next slide please. Okay, the AIDS or HIV infection, the curable disease. Answer is not yet as of year 2020. Curable means we are able to eliminate the microorganism or HIV from our body. If one of two or three or thousands of stay, but quiet doesn't mean cure. Cure must be removed from our body. But according to the most recent data, as I mentioned it, more than 60 years virus will stay even with no symptoms. Alright, next slide please. Okay, how HIV mother to child transmission occur? Within the uterus, birth canal, kissing, breast milk. Answer is 2. Birth canal, breast milk contain HIV. Why not in the uterus? Why not in the uterus? They are floating in the uterus. Huh? Shampoo. They stay for 10 months. Why they not infected? HIV is a blood. Mother's blood goes to the baby. Right? They send the oxygen and everything, the nutrition, everything through the mother's blood. The fetus doesn't cook by himself or herself. Why? Why the patient are not infected in the uterus? Your client may ask, why? You cannot answer, you cannot qualify to be talked to. Why? Where is the virus? Mother's blood, right? Huh? Mother's blood has HIV, right?
Yes.
But baby's blood doesn't have HIV, not infected. Why? Anything barrier between a baby and mother? Huh? Do you know, most of them are female, I don't know, I never had a pregnant, so you should know. What is the barrier between the mother's blood and the baby? Yes, placenta. Placenta is something that I don't know, I never ate it before, so. Placenta, the virus cannot go through. The pore is much smaller than the size of the virus. That's the reason. Okay, next slide. Sorry. Alright. So birth canal is a lot of the fluid exposed to the eye, nose, that's the reason. The breast milk also. There is no barrier. Right, next slide. The antiretrovirus medicine free of the charge in Kenya?
Yes.
Are you sure?
Yes.
What about the foreigner?
You don't know about foreigners.
If I get infected, come from US, but I didn't take a medicine, but I developed a symptom, can I go to the government? Can I have the ARV?
You must be tested first.
Huh?
You must go through the city first.
But okay, if I found it in here,
You will be helped.
they will give us free.
Yes. Sorry, yes, it is free.
In United States, I don't know Japan. In United States, of course, American citizen, and even illegal immigrant from Mexico or some other. If they found it, no matter what their status, stay in the United States is not related to giving the medicine. Alright, so it is free. Cost about $3 million per year. free of the charge. Okay, so this is very interesting, I think. Okay, next slide, please. All right, so yes, the government, the distribution are free of the charge. But this is only ARV. What about the pneumocystic clinical treatment of the pneumonia? Treatment of the Kaposi sarcoma? Huh? If they develop, do they cover? Do they support? No. Only support is TB. TB medicine is free. But United States, all the medicine related to optic infection is free. Otherwise, patient gets the pneumonia, PCP, go home, die. Okay? So, the not only should not, even the TB is free, but also other cancer infection, Kaposi sarcoma, radiations, blah, blah, blah. If AIDS related, everything is free in the United States. Next slide. Alright, what does the standard HIV test identify? The HIV test or VCT, the facility, what they check it? What do they check? RNA strains or T cell count or antibody and or antigen? Answer is antibody and antigen. Okay? However, most of this country use for the Abbott, the HIV determinants, the test is only detected through the antibody. Okay? Our facility use both, we can detect it. What's the difference between the detection of antibody or what the antibody or antigen? We use for the antigen antibody both. Antibody production after the infection, it takes 3 months to 6 months. So patient comes, I had there's some sexual activity with unknown person, I may be infected because she looks sick. He's afraid. Okay, let's take it. She came to the facility after 1 month. Let's say 2 months. I said antibody production it takes 3 to 6 months. But patient comes to about 1 month to our facility. So antibody was not developed because it's not the 3 months yet. But if she or he is infected, antigen, virus should be detected before production of antibody. That's why we use both. Next slide, please. This is not easy to see. There is a line. This will be a control line. You cannot see it. Yeah. Okay. This is the control line. All the distance that show the line, and also here. And second one is antibody. If positive line, it is positive. But antigen is not. But this one is antigen positive. This line is no line here. So we are detecting this is about 1 month before she was infected. And go to the other facility. She went to the other facility. Hey, you are negative, don't worry. No, it was positive. The stage was before the development of HIV, the antibody. So such a type of thing. So I'm not saying don't trust in the result of the BCT facility. They use only the HIV antibody detection kit, not for the antibody because this is expensive. They are free. But we try to use for this ones to the government as much as possible. Otherwise, it is very dangerous. And she went to the other facility. I was told by the antigen was positive. Clinical officer doesn't know. HIV test, she was negative. Don't worry. But she was preventative. Right? That's right, please. Next one is antiretroviral medicine should start when? First one is CD4 count should become less than 200, or no treatment is necessary until get sick, or wetness and infected